So I teach something called pathology, which includes things like immunity. I got my first dose. It gave me the confidence that I could go and like hug my weeks and months after the vaccine than having actual COVID does. So does it then stick to the virus when it infects you and stops it from damaging your cells. So if we're lucky and everybody gets their vaccine, then we managed. So I'm Tristan. I'm a fourth year medical student at the University of Cambridge, and I also actually spent some of my time teaching one of the younger years. So I teach something called pathology, which includes things like immunity and viruses and how they affect the body.
That is so lucky. Because guess what we're here to talk about?
I got my vaccines because it would protect me. Back when I got my first dose, it was still very kind of touch and go as to whether you could visit family members and things like that, and it gave me the confidence that I could go and like hug my grandma. It's since let me travel as well. And obviously because I'm on the wards quite a lot now, I have a lot of peace of mind that when I see patients, I'm not causing them any risk or any harm. I wasn't particularly worried, no. I got arm pain like a lot of people did, but that was only for the first few hours afterwards, and it didn't stop me from doing anything. Otherwise I felt, well, I was still worried because there's always a small chance that it does cause some very serious disease. First of all, and we can go into that a little bit more, and also because getting COVID isn't just about you, it's about everyone else you've been in contact with beforehand. They then might have to self-isolate, or they might get COVID and they might be more ill than you were. So I was scared for that reason. Very worried about long COVID. I already feel tired enough as it is, so getting long COVID would have been pretty rough. But luckily I've had COVID, but I've not developed any long-term symptoms, because we know that the vaccine lessens the symptoms that you get when you do have a COVID infection. So who knows? You do hear a lot that young people don't need to get vaccinated, and that's a big lie. First of all, because we've said it helps protect other people, but also if you look at the data for 2021, 6,800 people between the ages of 10 and 39 died that year, and it was 3,600 people there who were unvaccinated and died from COVID infection, and only 50 who were vaccinated. So if you do the maths, that it's rough maths. It's not an exact science just from those numbers, but you can say, well, getting the vaccine gives you 80 times less chance to really develop very severe COVID and die from COVID if you do get it. So, and that's in young people. So it obviously does give a big benefit. So we know that when you have a vaccine, it actually gives you better protection in the very, in the weeks and months after the vaccine than having actual COVID does. So in that sense, getting the vaccine gives you stronger immunity at first compared to getting COVID itself. But the problem, one of the problems with the vaccine that we're facing now is that the immunity drops off over time, and that's because mechanisms, the cells in your body that give you immunity start forgetting what they've seen. So that's things called T cells, which go and look at cells and see if they're infected with COVID, and if they are, they kill them, stop it in its tracks. And it's also things called B cells, which when you get vaccinated, they learn that this is what the virus looks like, and they start making antibodies that then stick to the virus when it infects you and stops it from damaging your cells. So the big problem with that is that you then need several more doses. And now luckily in the UK we've got enough doses that everybody can have 3 doses. There's big vaccine uptake, so now more than half of the UK has had their second dose. And that, as I said, this doesn't mean that the vaccine isn't effective. It's very, very effective and one of the best vaccines we've ever seen, but it means that you do need to keep getting it regularly. With any luck, and so far science has really pulled through on this, and maybe we can expect to see that at some point, as they develop more science and the vaccines get tweaked and improved, maybe we won't have to give them so often. And alongside that, it might be that COVID, if we're lucky and everybody gets their vaccines and we manage to socially distance and all of those measures, that COVID just isn't that common afterwards, and so then vaccines don't need to be quite as strict as they are now. So who knows, but hopefully we'll end up with 100% vaccine protection from, just a few more doses. And I can understand at first why you might be worried about getting a vaccine. It's a medical treatment. It does have some side effects, very common ones like arm pain, which aren't very serious at all and tend to go away within a day, There are some more serious side effects, but they're so incredibly rare. And, in order for it to make sense, you'd have to, stop using cars and stop going out. You're much more likely to suffer some kind of accident there than you are from getting a COVID vaccine. And it protects you, it protects others, it lets you go out and enjoy life, with confidence again, knowing that everyone around you is safe. So, as far as I see, there's no reason why not to get the vaccine.
Sweet. Cheers, Tristan.
Means that I could go and hug my weeks and months after the vaccine than having actual COVID does. So then stick to the virus when it infects you and stops it from damaging your cells. So if we're lucky and everybody gets their vaccine, then we